you spent time studying in Israel, and while we've been talking about the use of your platform in the context of biopharma patients, there's another real-world example I'd like you to touch on. So, can you talk about how your platform was used following the October 7, 2023 Hamas attacks in Israel?
So October 7th was a Saturday. That Monday was Columbus Day. On Tuesday, I pulled together a team and said, we're going to go help. And we reached out to every doctor in America and said, who wants to go in Israel? They need doctors. They need help. At the time, there was a shortage of doctors. They called up the reserves. So there was no doctors at hospitals anymore. And then there was a need for all these different types of specialists. People talk about the 1,200 people that were killed, 5,000 people that were injured, limbs, all these things. And so we ended up just flying doctors to Israel. We reached out to every doctor in Israel and said, where do you need help? Reached out to the Ministry of Health, started flying doctors to Israel. Fast forward a few months, the war was in Gaza. And we did the same thing in Gaza. We started partnering with the world's largest NGOs, the World Health Organization, Save the Children, Project Hope. And we were in contact with the majority of physicians in Gaza. A lot of them were displaced from the north at the time. We got in contact with them and we connected them to the NGOs in the south of Gaza. And remember, every doctor in the world, which includes all the doctors in Gaza,
Yeah.
as well as in the West Bank. And so I don't know if there was another company that was able to get in touch with all the doctors at Al Shifa Hospital in Gaza that was no longer functioning, and those doctors still wanted to help. I'm actually still in contact over WhatsApp with a lot of these doctors in Gaza and Israel. But we were able to connect them to the NGOs. After that, we did the same thing in Ukraine. We somehow built up a good brand within these NGOs of being able to get doctors and be in touch with doctors that nobody else knew about because we have
Mhm.
every doctor in the world. And that is how we went viral in Zambia. There was a cholera scare in Zambia, and the Ministry of Health told all their physicians to sign up for H1. So in overnight, we had thousands of people in Zambia sign up. Which I didn't know much about Zambia until that happened, and I was pretty excited about it. And so we're continuing to help with humanitarian missions and sending doctors